Hi, this is Pete Chekanowski. My presentation on ulcerative colitis. Today we're going to examine the digestive system disorder known as ulcerative colitis, which is a form of irritable bowel syndrome or IBS and can affect any part of the colon, the ascending colon, transverse colon, descending colon, sigmoid colon, rectum, or the entirety of the colon. Ulcerative colitis is a chronic disease, and it has flare-ups and relapses and is primarily idiopathic. The exact cause is unknown, but it's the result of a defective immune system. Things like dietary habits, environmental factors, genetics, and infectious microbes play a role. Pro-inflammatory cytokines, including interleukins and TNF or tumor necrosis factor, as well as macrophage excesses in the mucosal tissue of the colon, play a role. Almost 1 million Americans have ulcerative colitis. Typically, the onset is between the age of 15 and 30. Men and women are equally affected. As age increases, men are more likely to be diagnosed. Also, individuals who have a first-degree relative, such as a parent or a sibling, are at an increased risk. Ulcerative colitis involves possibly the entire colon or parts of the colon. The tissue damage is limited to the mucosa layer of the colon and also does not include skip lesions, which is common in Crohn's disease. Inflammatory cytokines are released, which activate neutrophils, lymphocytes, plasma cells, macrophages, eosinophils, and mast cells, which damages the mucosal barrier. Chronic inflammation leads to ulcerations, abscesses, and necrotic tissue. Ultimately, the muscularis is thickened and polyps develop from rapidly regenerating epithelium. Frank blood in the stool or hematochezia is apparent in a flare-up. Large amounts of watery diarrhea are passed due to damaged absorptive tissue. Cramping pain is common. Red flags include positive family history, other immune disorders, which could include like lupus or rheumatoid arthritis, frequent bowel movements, and blood and mucus in the stool. A colonoscopy would reveal inflammation and hemorrhaging of the mucosal layer. Lab values could include anemia, hypokalemia, hypoalbuminemia, and other symptoms could include migratory polyarthritis and sacroiliitis, which is low back pain, and also liver sclerosis. It's difficult to differentiate between Crohn's disease and ulcerative colitis without a colonoscopy. So the colonoscopy reveals the red, inflamed, hemorrhagic mucosa. Patients can be educated about symptoms of flare-ups and what actions to take. Exacerbations include severity of the bloody stools, severity of cramping, and frequency. Treatments could include medications such as aminosalicylates, steroids, immunosuppressants, and biologics, as well as novel small molecule medicine. Thank you very much.